In this video, I wanted to share with you very important and useful information, particularly safety and precautionary measures to be taken care by NSS volunteers. In my presentation, I'm going to be cover the titles, the safe practices at home and how to use the mask, and what are the precautions and safety measures to be followed once you reach the home after performing your duties. It's very important to have your very good food habits and regular physical exercises and mental exercises during this COVID-19 period. I request all the NSS volunteers pay the attention during my presentation. Now let's have a look at what are the safe practices at home after performing your duties. This will make protection to yourself as well as your family members. This practices as provided in the chapter number 10. They mentioned about the 5. Once you go through all these 5, they are going to be very helpful for protecting yourself as well as other family members in your home. Once you reach the home, stay away from the others. Stay in specific room and away from the other people in your home. Try to maintain always the distance at least of 1 meter, and also restrict the movements yourself so that others in the house stay safe from the infection. And it's very important to seek health care conditions of yourself, and also you should notice your health conditions. If you are suffering from the fever or cough and having the difficulty in breathing, wear the mask to protect the others, and immediately get touch with your nearest health facility center or contact the ASHA workers or ANM staff. It is always important to wear the mask. As for the new guidelines of Government of India and state local governments, it is very important to wear the mask whenever we are going out of the home to perform our duties. It is very important to know about how to use the mask and when to replace the mask. So you have here the usage of the masks and related information in the chapter number 14 of the COVID-19 book. Let's have the look at what are the way to usage of the mask. So whenever you have here single usable marks which I wear here, you should always unfold the pleats and facing down, place over the nose, mouth and chin. It should be fully covered like this. This is the best way to cover the mask. And later you should also aware about replacement of single usage masks is compulsory. When you feel your mask is become damp and humid, try to replace it, and remove the masks always with the proper technique. Similar way, disposing of the mask also should be followed here, proper techniques and proper practices. Don't dispose your masks in the open spaces. Try to put it in the dustbin and close it properly. So these are the practices you have to be followed whenever you are using the masks. When you reach the home after performing your duties, it is very important to be followed many precautions and safety measures after reaching the home. You have to be followed here the 5 best precautions and safety measures as given in the chapter number 16. Then the first one you have to do here, carefully remove your face masks and gloves if you are using in the correct method, and dispose of used masks or gloves by throwing them into the covered dustbin. So you shouldn't put under any circumstances the masks and gloves in the open dustbins. Whatever you carried for your duties and responsibilities like a bag or registers and all, they all must wipe them down with the proper disinfectant solution. It's very easy to make disinfectant solutions. And as you have been regularly seeing, washing of the hands is very important. So we have to practice. It is a common regular practice for every NSS volunteer. Wash your hands with the soap and water for minimum 20 seconds. If you get any symptom like a cold, cough, or fever, immediately contact nearest government facility or your ASHA workers or ASHA staff, ANMW staff, whoever is close to you, you just contact them. Then, yeah, if you summarize all the safe practices to be promoted, there are here five best practices you should have all the time. One is it is very important to follow as a regular practice the frequent hand washing, maintaining the social distancing, avoid touching the eyes, nose, and mouth. It is very important to practice good respiratory hygiene, like covering your mouth, nose with a handkerchief or tissue whenever you have a cough or sneeze. It is most important, stay informed and take care and follow the advices from ANM or ASHA or AWW workers whenever you feel like cough or sneezing in health point of view. Before switching to understand what are the good food habits and physical exercises to be followed, it's very important to understand the biggest weapon for all NSS volunteers are using the concept of social distancing. So maintaining the social distancing is the biggest weapon. As for the expert views and new surveys and global experiences, after the lockdown also the same situation may be continued for some more months. As you all know that lockdown is not the curing technique. This is the technique can help us to not to spread virus quickly in the society. So we must have here healthy habits and regular exercises during this period. So in this slide, I wanted to share with you how to keep yourself healthy and fit mentally and physically. So there are four simple practices you need to be followed. Uh, Eat always the healthy food. So ensure that it should be the nutrition food, and have a plenty of water every day. If you drink the lime water, that help you to improve your immunity system. 8 hours of sleep and have a good sleep every day. Don't take any stress or mental tensions into your bedroom, and avoid the refrigerator or cool drinks, and try to away from the AC rooms. And it's very also important avoiding of the junk food. Don't get any delivery food items outside the home. And to keep your physical fitness healthy, very important to have your daily walk and exercise that help in both aspects like mentally and physically. So same information you should also communicate with all your family members and your neighbors, and you should share about the healthy habits with all the people around us. All the NSS volunteers must remember and understand the importance of the self-care, best practices at home, and social distance. All of us may not get an opportunity to fight as a frontline warriors, but we are also main warriors in the COVID-19 war. So we have to be sincere warriors in the COVID war, but should not be carriers of the virus. We all must be like a rifles in the war, should not be a refills of the virus. We all must fight against the COVID-19 alone like a lion. We should not form the lines to give the scope to spread the virus. Let's all take the pledge to contribute our sincere efforts to control the virus and to fulfill our duties and fight against the COVID-19 even after the lockdown. Take care of yourself. Thank you very much for watching this video.